And good morning as everyone entered the room this morning. We're going to get started shortly. We're going to have more folks come into the room. Today we're having a talk on Medicare 101 with Ms. Melissa Devine. And we're going to start with some housekeeping this morning. This is a webinar, so you don't have to worry about muting yourselves. We're going to have question and answers at the end of the presentation. So if you have a question, you can just type it in the Q&A box. And at that time, at the end of the presentation, we can go over those questions. So with no further ado, this is Melissa Devine. She's going to introduce herself and we can get started.
I am Melissa Devine. I am with the Area Agency on Aging 1B through the Medicare Medicaid Assistance Program Department. So we are a nonprofit. We are unbiased because we're not affiliated with insurance companies, and our services are confidential and secure and completely free. So we come out to educate and empower those that are on Medicare or about to be on Medicare and their family members. So then that way you guys can make informed decisions on your Medicare coverage. So today, I'm going to share my screen here and show you this presentation. We will be talking about our Medicare 101. We're going to go about all of the basics today. So what we're going to cover is who MAP is, what we do, and of course, the ins and outs of Medicare, from what Medicare is, who can enroll, how to enroll, the different parts, wellness and preventative services, fraud and abuse, and more. So MAP Inc. As I said before, we are comprised of certified counselors who have gone through extensive training. Our MAP counselors, again, are not affiliated with any insurance companies. They are not going to be biased to a certain company to get a commission or anything like that. We're going to make sure that when we help you address any of your Medicare, Medicaid concerns, that we do so in a fair, unbiased way. So what can our MAP counselors help you with? Well, we can help you understand your Medicare health plans. We can help you compare and enroll in Medicare Advantage coverage. We can help you compare and enroll in Medicare prescription drug coverage. We can help you identify and report Medicare and Medicaid fraud and scams. We can help with enrollments into low-income programs like the low-income subsidy through Social Security or Medicaid through Department of Health and Human Services. And we can also help you enroll and compare, I should say enroll in some, but definitely compare Medigap policies as well. So let's take a look here at Medicare. What is it? Medicare is insurance for three groups of people: those that are 65 and older, those that are under 65 with certain disabilities, and they do need to be deemed disabled through Social Security, and those of any age who have end-stage renal disease or ESRD. It is administered through the Centers for Medicare and Medicaid Services, also known as CMS or 1-800-MEDICARE. And the enrollments take place through Social Security for most individuals, but for railroad retirees, that's going to take place through the Railroad Retirement Board. So Medicare has well-defined benefits and exclusions. It typically does not cover dental, vision, or hearing unless under certain circumstances, and or if you were to enroll in a Medicare Advantage plan that has those extra benefits. It does not cover long-term custodial care. That is certainly something that's a Medicaid option, but it's not a Medicare. And it places limits on certain care items such as physical therapy, durable medical equipment, and more. It also does not typically cover over-the-counter medications unless you have like a Medicare Advantage plan that may offer some of those options. Medicare does work with private insurance companies to provide you coverage. And it also works with the private insurance companies to provide you Part D coverage, the supplemental or Medigap plans, which help fill in those out-of-pocket expenses in original Medicare. And It also works with Medicare Advantage plans. So that's the plan that's going to combine the original Medicare A and B services, usually with prescription drug coverage, and then again, some extra benefits like dental, vision, and hearing. So when it's time to enroll in Medicare, if you are receiving Social Security retirement benefits, railroad retirement benefits, or you've been disabled and deemed disabled by Social Security for 24 months or longer, then your enrollment into Medicare is automatic when it's time for you to be in that. So 3 months before the 25th month of disability benefits, or 3 months before you turn 65, you'll get an initial enrollment period package from Social Security, or technically from the Department of Health and Human Services for the US. So it might look a little different than a Social Security envelope. But if you're not automatically enrolled because you're not receiving Social Security benefits or Railroad Retirement Board benefits, then you would have to do an enrollment yourself through Social Security or the Railroad Retirement Board. And for folks who are typically still actively working, you may choose to delay the enrollment if you will not receive any late enrollment penalties and you have creditable coverage. But enrollment with Social Security can be done by visiting the local office, by calling their number and connecting with a Social Security agent, and even online at ssa.gov. And a MAP counselor can actually help you do that online enrollment through Social Security for Medicare. Now, if you are retired from the Railroad Retirement Board, again, you'll have to enroll with your local Railroad Retirement Board office. But we do have an 800 number here on the slide that you can use to call to find the local office. And this is an example of what the Medicare card looks like. A couple of years ago, they switched them from the Social Security numbers to unique set of numbers and letters that are, again, specific to you. Nobody is going to have those exact numbers and letters. It is going to be exclusively for you. The front will tell the office, wherever you take it to, the pharmacy, the doctor, the hospital. It'll tell them your name. It'll have your Medicare ID number, and then it'll also tell them if you have Part A and B or just Part A, and when that coverage started. Now, if you're new to Medicare and let's say you have creditable coverage through employee coverage and you choose to delay the enrollment into Part B, the directions on how to refuse Part B is on the back of the card. And you can just follow them, you sign it, you get it sent back off, and then they send you a new card with just the Part A information on it. But that's definitely a very specific situation. So you would want to connect with a MAP counselor just to confirm that you're not going to create a situation where you don't have a special enrollment period to enroll in Part B, and so that you don't end up with late enrollment penalties. So there's 4 parts to Medicare. There is Part A, which is your hospital insurance. There's Part B, the medical insurance. So at the doctor's office, the specialist, physical therapy, anything pretty much outpatient. And then you've got Part D, which is the Medicare prescription drug coverage. So that's going to be a specific plan that only goes to the pharmacy for your prescription drugs. And then you've got Part C, which is the Medicare Advantage plans. Again, those are the combination of Part A, Part B, and Part D into one plan. They are HMOs and PPOs, and you typically need to follow their in-network providers to be able to receive care and have it billed under that insurance. So when you first join Medicare, you have a couple of options on how you can receive your care or your insurance. The first is Original Medicare, which is on the left side of the screen. It includes having your red, white, and blue Medicare ID card like we showed you earlier. That's going to give you your Part A hospital insurance and your Part B medical insurance, so your outpatient insurance. And you're going to want to elect to enroll in what we call a standalone Part D plan. And these standalone Part D plans provide only prescription drug coverage at the pharmacy. That's it. They might cover some vaccines at the pharmacy, but it's not going to be something you can take to the doctor's office. I should say the hospital. If you get a vaccine that's covered under Part D, you might have to take it to the doctor's office, but you would not typically take that anywhere other than the pharmacy. You can also elect to enroll in a Medigap policy, which is a Medicare supplement insurance policy. Again, these are meant to help pay those out-of-pocket costs in original Medicare. So they help cover the benefit period deductible for Part A, the Part A coinsurances and copays, the Part B coinsurances and copays, and more. And then you've got the second option would be Medicare Advantage plan or Part C. So you would enroll in one plan and it would provide you coverage for Part A, Part B, and Part D. And some plans also cover extra benefits like dental, vision, hearing, potentially some transportation, and more. But these plans, again, are HMOs, PPOs, and you do have to follow their guidelines and receive care through their in-network providers. So let's take a look at original Medicare. This is the care that you would receive with just the red, white, and blue Medicare ID card. So Part A, again, hospital insurance. It's going to cover any care you receive at the hospital, the skilled nursing facility, home health care if needed based off of a hospitalization, and hospice care. Then you've got Part B. That's going to be the medical insurance for outpatient services. So anytime you go to your primary care or a specialist, or if you have an outpatient hospital service, clinical lab testing and preventative services, all is going to fall under that Part B insurance. Here's a quick look here at some of the costs for 2022. We'll have 2023's information in the fall. Typically, we get those premiums and the benefit period deductibles and all of that closer to December. But stay tuned because we will be coming back for a presentation in the fall. So if you were to be hospitalized this year, though, for the first 60 days, if you were admitted in the hospital, not under observation, but admitted into the hospital, your benefit period deductible is $1,556. And then if you had to stay longer than 60 days, days 61 to 90 is a $389 a day copay. Excuse me. If you were to be in the hospital for 91 to 150 days, then it's a $778 copay a day. Anything beyond 150 days, you would incur all costs. But if you were under an admission and you needed some following skilled nursing facility care the first 20 days, you would pay nothing in that benefit period. If you needed an additional 80, that's when you're looking at a copay of $194.50 a day. And then anything beyond 100 days would be all costs incurred by you. And then, as you go through, you can just see there's usually a 20% coinsurance for durable medical equipment. That would fall under Medicare Part B. But if you needed home health care itself, you'd get up to 100 visits following a 3 full day hospital stay, as long as you met the Medicare conditions. So again, you would have had to have been under admission in the hospital, so not under observation. And your doctor would have to provide proof as to why you need home health care. If you were to receive hospice care, it's available to you as long as the doctor certifies the need, and it's limited cost typically for outpatient medications and inpatient respite care. If you needed a blood transfusion or any blood necessary in the hospital, it's unlimited if medically necessary. You are just responsible for the first 3 pints. Some hospitals allow family members to donate 3 pints in exchange. Some just choose to charge for the first 3 pints. It's just a matter of what the hospital is interested in doing. Typically for most individuals who have worked into Social Security for a little bit of time here, they usually don't see a premium. But if you did not work full quarters into Social Security, which is typically 40, then you would potentially have a premium, and it just varies based off of your work history. But there's more information available to that through Social Security. And I would highly encourage you to create a myssa.gov account if you do not already have one. It actually allows you to keep track of those things, including any enrollments into Medicare at a later point in time and more. So check it out if you haven't already. Here's a quick look at the Part B costs. So as you guys know, this year, if you have Medicare, the monthly premium is $170.10 a month. And then you have an annual deductible for Part B, which for this year is $233. Typically, any services that you receive at the doctor's office, physical therapy, speech therapy, durable medical equipment, etc., they all are a 20% coinsurance of the approved amount after that $233 deductible has been met. Are you going to meet that deductible the first time you go to the doctor? Not necessarily. It's all dependent upon what you're there for and what they're billing out for and what the amount is. If you need clinical lab services like blood tests or urine analysis, etc., you can have as much of that as needed and is medically necessary, and you don't pay anything for those. Home health care, pretty similar to Part A. It's unlimited as long as you meet the Medicare conditions, and you pay nothing for the services, just 20% of the approved amount for the durable medical equipment. And then any outpatient hospital treatments, again, unlimited as long as they're medically necessary, and you just pay the 20% of the billed amount after meeting that annual deductible. And blood, same thing. If you needed a transfusion or if you needed to get, some blood, it's going to be unlimited if medically necessary. You just pay for the first 3 pints plus 20% of the approved amount for anything additional. So Part D. Part D, technically, according to the Medicare New Book, is considered optional. I'm going to roll my eyes really hard at that statement or that word, optional. It's not really optional. If you don't take a Medicare prescription drug coverage, whether it's through a standalone Part D plan or a Medicare Advantage plan, when you're first eligible, and if you don't have creditable coverage, then you can end up with a late enrollment penalty and or delay having that coverage. So, well, it says it's optional. It's not something I would consider to be optional. But Part D, again, covers that Medicare prescription drug coverage. It's provided by private insurance companies. You do have to choose the plan that you want to join and join it. It's not something that's automatically assigned to you. Every plan does have a formulary list. So that's the list of medications that they are going to cover, which is why it's really important to do plan comparisons, because if you don't, you may end up in a plan that doesn't cover your meds. They also may require that you pay a drug plan premium. They may have deductibles. They set their own copays for the medications on their formulary list, based off of, whether it's a generic or a brand and so forth. But also they have their own list of in-network pharmacies as well. So it's very important that you, have all that information handy when you want to look at some Part D options. So in order to join Part D, you have to have Medicare Part A and or Part B. So if you delay enrollment into Part B because you've got employee coverage, but the employee coverage doesn't provide drug coverage, then you may want to jump into Part A and Part D and delay that enrollment for Part B. But again, that's going to be a very specific situation that you'd want to reach out to MAP to discuss. You do need to live in the plan service area. So if you want to get a plan, you have to get one in Michigan if you live in Michigan. If you lived in Ohio, you'd have to get an Ohio plan. You cannot live outside of the US. So you cannot live in Canada, Mexico, or anywhere else outside of the US. You cannot be incarcerated. And you must choose to enroll in that Medicare Part D plan. It's, again, not an automatic enrollment. It is as simple as an online application through Medicare.gov's website and or sitting down with a MAP counselor and letting us assist you through that. So again, Part D coverage, it's available for all individuals with original Medicare, so Parts A and or B. You would typically see a standalone Part D plan for those with original Medicare. However, if you needed drug coverage and you wanted a Medicare Advantage plan, then you would look for a Medicare Advantage plan that provides drug coverage. And every plan, regardless of whether it's Part D or through Part C, the Medicare Advantage plans, they all have to cover a certain amount of medications and certain medications in different categories. So there is going to automatically always be coverage for people who need mental health medications. Perhaps you need a medication to assist with diabetes and things like that. They have to include some sort of medication in that category, no matter what. So when to join a Part D plan? Well, if you're new to Medicare, you definitely want to do it during your 7-month initial enrollment period. If you remember correctly, typically 3 months before you turn 65 or 3 months before your 25th month of disability is when you're going to want to either, if you're not automatically enrolled in it, enroll in Medicare and then enroll in your coverage. So Part D or MA or Medigap, whatever it is that you choose. You've got 7 months total because it starts 3 months before you turn 65. It's available the month you turn 65 and 3 months after you turn 65. Then you've also got the option to do enrollment changes or enrollments during the annual open enrollment period in the fall. That's October 15th through December 7th. Anything that you elect to enroll in during that time frame, that coverage will start January 1st the following year. So if you visit with us in October this year, the coverage that you pick will start January 1st, 2023. There may be opportunities for special enrollment periods. That would be for those that are considered low income and have access to the low income subsidy through Social Security for the Part D coverage or Medicaid, etc. If you had an involuntary loss of creditable coverage, if you moved outside your plan service area, etc. So if you're not sure if you have a special enrollment period, reach out to MAP. We do have all of that information handy that we can always provide to you guys. And of course, if you want to join the plan, you can call the plan directly. You can visit Medicare.gov. But if you want some of the best personal service, definitely give MAP a call. We're happy to assist. Again, our services are free. They are confidential. They are unbiased. We're not going to direct you to a plan just because of a name. We're going to make sure you're getting full coverage at the lowest cost to you and make sure that you're happy with where you're headed. Now we're going to talk a little bit about Medigap. So Medigap policies, those are the supplemental policies that are sold by private insurance companies. They help to fill in the gaps in original Medicare. So they help cover the deductibles, coinsurance, copayments. Again, these deductibles that they cover are going to be the Part A benefit period deductible. There are currently no plans available to new beneficiaries to Medicare, so new enrollees. There aren't any plans that cover the Part B deductible anymore. There used to be, but as of January 1st, 2020, Congress decided to level the playing field and they got rid of the option for Plan C and F for individuals. So all of the plans, though, are organized by letter. All of the plans of the same letter have the same coverage. The cost is going to vary based off of how the plans are rated. Some of them are going to be community rated, which means that everybody's going to pay the same price regardless of age. Some are going to be issue age, so they're going to price it based off of the age you are in which you purchased the policy. So it can be cheaper for those that are coming into Medicare at 65. But if you're choosing to change your plan or whatever, then it can get to the point where it might be a little more costly because they'll look at your age and price it accordingly. And then there's also attained age, and that's going to be where it's priced based off the age you are in which you get the plan, and it'll go up each year based off of how much older you are. So again, the coverage is going to be the same for the letter no matter what. It's just how the plans are rated as to why those costs are different for Blue Cross Blue Shield versus AARP United Healthcare versus State Farm versus USAA. And not all plans are going to be offered to people under 65 with a disability. Unfortunately, but fortunately, Michigan is one of the states where it has to offer at least one plan option, but it doesn't have to be more than one plan option. So, and they typically tend to be a little bit more costly for folks under 65 with disability. But if it's something that you're interested in, definitely give MAP a call. We can give you a comparison on those Medigap policies so that you can pick the best plan for you. All of these plans also have to cover at least the basic benefits. And the basic benefits for Medigap's policies are going to be covering the Part A coinsurance and hospital costs, the Part B coinsurance and copayments once that annual deductible has been met, the first 3 pints of blood if you needed a transfusion, and Part A hospice care coinsurance and copayments. After those 4 benefits, anything that they provide that's extra is going to be what they call an enhanced benefit. So you can see on the columns here, you've got A through N for your plan options. A is going to have just the basic coverage, so just those 4 things that we talked about. And as you go up the columns to the different letters, they offer a little more coverage. For folks who knew about Plan C and F, but came into Medicare after 2020, the best alternative is Plan D and G. Now we're going to take a look at the Medicare Advantage plans. Again, these are health plan options approved by Medicare, run by private insurance companies. Medicare is going to pay a certain amount for each member's care. It's another way to get your Medicare coverage. It's still a part of the Medicare program, but you will have to use that Medicare Advantage plan's network doctors and hospitals. So because you're still in Medicare with a Part C or a Medicare Advantage plan, you're still within all of the rights and same protections as anybody who has original Medicare. You're still going to get Part A and Part B services. And these plans typically provide prescription drug coverage. They may even include extra benefits like dental, vision, and hearing. Some offer transportation, some offer meals and whatnot. But the benefits and the cost sharing is going to be different between the plans. And it's definitely something that you're going to want to get a comparison on and confirm that your providers are in network before you enroll. When to join. So again, you've got that 7-month initial enrollment period to join. You can join during the annual fall open enrollment period. So October 15th through December 7th. Again, though, the coverage would just begin January 1st the following year. And if you have a Medicare Advantage plan that you're a part of beginning January 1st, then you can utilize the Medicare Advantage plan open enrollment period, which is January 1st through March each year. Again, you can contact the plans by calling their number to enroll. You can enroll through Medicare.gov, but for the best assistance possible to make sure you're in the absolute best plan for you, call MAP, let us do a comparison for you. Again, completely unbiased, confidential, and you're really going to make sure that you get maximum coverage for the lowest cost. So now let's take a quick second to look at the wellness and preventative services through Medicare. Many folks don't know that when they join Medicare, they get what's called a welcome to Medicare visit. This is a one-time visit at the beginning of your Medicare coverage. It's got to be provided within the first 12 months of getting Medicare Part B, but you'll get to go to the doctor, do a review of medical and social history. They'll take a look at your height, weight, body mass index, etc. They might provide a simple vision test, but the doctor will be able to sit down, educate you on your health, do some what we consider health counseling, and even set up treatment plans. So maybe the doctor says, in 2 years, I want you to go do this, and I want you to do that, and we're going to meet back in 6 months for this. They can set all that up with you during that welcome to Medicare visit. And after you've received that, you also get a yearly wellness visit. It has to be a full 12 months after that first welcome to Medicare visit. But again, they're going to do similar things. It's going to be, blood pressure check, height and weight measurements, personalized prevention plan, written schedule for screenings, health advice for you, referrals to health education and preventative counseling. All of those will be available to you. And just like the yearly wellness visit, this welcome to Medicare visit that we talked about prior, both of those are covered at no cost to you as long as your provider accepts assignment to Medicare. There's also coverage for certain screenings like mammograms, colonoscopies, prostate cancer screenings, flu shots, etc. Majority of them are a zero cost to you. You're just going to pay a 20% co-insurance for the hospital copay or the doctor visit itself. But otherwise, it should be no cost to you. There's also recommended vaccines. So Medicare recommends that individuals receive at least 1 flu shot per year, a Tdap or tetanus, diphtheria, pertussis. Those are every 10 years you get a booster. They also recommend pneumonia vaccines, shingles vaccines, MMRs, which is measles, mumps, rubella, hepatitis A and B, meningococcal, and of course, now that we've had the pandemic for a hot minute, they're also recommending the COVID-19 vaccines and the boosters. But as always, we always recommend that you consult with your doctor and pharmacist to make sure you're getting the vaccines that are recommended for you. But these are covered vaccines under Medicare. Now we're going to take a look at the Medicare assistance programs. There is help for people who have limited income and resources. We understand that typically if you have turned 65 and are what we consider to be aging into Medicare, you might have limited income. You might be retiring. And, you know, we understand that with that can come some financial challenges. And so we are able to and ready to assist with applications into the Extra Help program, which helps pay for that prescription drug costs, assist with Medicaid applications, which includes the Medicare Savings Program. There may be pharmaceutical assistance programs that we can help you get your medications at a lower cost, and even prescription saving cards like GoodRx. So, you know, if that's something that you are currently dealing with, let us know and let us help connect you with the proper program that could assist with some of that. Then you've got some Medicare fraud and abuse. So quick word about fraud and abuse. It is the most common thing that affects individuals with Medicare and Medicaid. I see it all the time, and it was super terrible last fall. It can be as simple as a company using false information to mislead you into joining their plan, like all of those commercials with these football stars talking about how they got X amount of dollars back by enrolling in a Medicare Advantage plan that may not even be available to you to use. You also have instances where people will bill you for services you never got, equipment that you never received or that you returned, or if someone uses your Medicare, Medicaid ID card for healthcare and they're not you. That's all considered fraud and abuse, and we can help. If you give us a call at our number, which I'll share with you guys here in the next slide, we can help assist reporting all of these issues, making sure that you don't have to pay out of pocket for something that you didn't receive and that you were billed for, and make sure that these people have to be held accountable. So we're here to help. If you want to speak to a MAP counselor about your specific situation, you are welcome to give us a call. We also do have a regular counselor there at Turner to provide counseling on Tuesdays and Thursdays. We're currently counseling over the phone and through Zoom, and some places in person, just depending upon the facility and whether they're open or not. But again, our services are confidential. We're unbiased. There's no question that's too trivial. We deal with very complicated questions as well. We are here to help. So for more information, you have access to stuff on Medicare's website, which is medicare.gov. You also should get the Medicare and You handbook every year. It should come to you in the fall, so September. You should be looking for a Medicare and You 2023. You can also always give Medicare a call at their 800 number, which is 800 Medicare. But for the most comprehensive and local Medicare information, give MAP a call. We've got you covered. Our number is 800-803-7174. We are here to help. We don't charge for our services, and we really just like being out there to help empower and educate you guys. So now we're to the Q&A portion. I'm going to leave this slide up so then that way you guys can see my contact info in case you'd rather reach out to me through email. But my email is listed, and you're welcome to, you know, holler at me and say, hey, you did that presentation and I really got a question for you. And I'm happy to answer. I do see that we've got a couple of questions in the Q&A. So I'm going to answer this. I'll answer these live. So is Medicare Advantage based on a grant? And if so, will the grant be ongoing? Medicare Advantage is not a grant. So Medicare Advantage, again, is through those private insurance companies, and they are they work with Medicare to make sure that they are receiving payment from Medicare. The program you might be thinking of is we used to have a grant available through the Michigan Health Endowment Funds for Medigap policies. That, however, it is something that is not optional anymore. They canceled that. So unfortunately, that grant is not available. The acronym of MAP, MMAP. So that is the Medicare Medicaid Assistance Program. And MAP is funded through grants. So we are technically the state's health insurance program. So we are federally funded through grants. And of course, local millage funds and things like that. But our counselors are volunteers. These are individuals who have retired from their professional careers and decided to give back to the community. So they've gone through, when I say extensive training, I mean extensive training. We're talking 10 to 16 hours of online training, 3 full days in-class training, constant every month updates and webinars that they have to attend to make sure they're up to date, and working with people like myself, the site coordinators for the program, to make sure that they're up to speed on everything too. So yeah, that's kind of how we're funded. So I've answered the questions in the Q&A. Let me see if there is.
Yeah.
Okay. I was going to say, yeah, it looks like there's one that said, will there be a PowerPoint available for printout after the meeting? I am going to send this over to Jen, and I believe she can probably get it out to you. Do you guys have that? Okay.
If you send it to me, I can send it out right after this is over to everyone.
Perfect. So yeah, we will definitely get that to you guys. And yeah, I think.
Is there any other questions?
I don't see any more in the Q&A, but if anybody wants to unmute and ask, I'm happy to answer.
Yeah, they can't unmute because this is a webinar,
gotcha.
so you will still have to just type your question in the Q&A box.
Medicare drug coverage. So John R. asked about Medicare drug coverage. What specifically would you like an answer for? John has his hand raised. Are we allowed to unmute him, or can we unmute him?
Yeah, I think so. Let's see.
John, are you available? Can you hear us? Or maybe you have to unmute.
You have to unmute yourself.
Okay.
Okay, so he's not able to. Yeah, he's not. Oh,
maybe he is. John, can you hear us?
Connected. Okay, I've been trying to help. Yes, Medicare, the Part D, the drug coverage. You're listing. Well, what if someone becomes hospitalized and they have medications that are not? I don't understand how you do this drug coverage.
Like maybe a medication that has to be done through infusion or things like that.
Yeah, is that covered?
Yeah, yep, it's covered under original Medicare though. So if you're going to have to be, in the hospital under admission or anything like that, it would be something that would take place under the original Medicare A and B coverage.
Because let's say earlier to enroll in Part D, you have to go through the list. You go through a list to see what drugs that are covered.
Definitely want to make sure you do that. You can list.
I don't know. If I have new drugs that I don't know what they're going to do.
And so that's kind of the dilemma, right? When we do enrollments in the fall for the following year, you do end up having to consider, whether you may be getting a new prescription or not. But if you happen to qualify for a special enrollment period at any point during the year and need to change plans due to coverage, that is something that we can assist with as well. So I would say the best answer I can give you is give us a call or shoot me an email or, call up Turner, ask to speak with Dave Cook. He is one of our certified counselors and we can walk through those specifics with you.
Yes. Dave Cook, okay. At Turner.
yes.
Okay. And I was also wondering about Medicare coverage area. Is it nationwide or is it just specific? I'm on Medicaid and right now, and I'm only covered within the state of Michigan.
Yeah. So original Medicare, which is that red, white, and blue card, that is nation based. So you could go anywhere in the US and use that coverage. There are
Go ahead.
There are a few Part D plans that are national as well, so you could utilize those at pharmacies over the, across the US.
Okay.
But any Medicare Advantage plans, those are region-based. So those are going to be plans that you really have to use in the state of Michigan at their network providers.
Okay.
Okay.
Hmm.
Thank you, John. So we're going to move on to Carol Collins has a question for you.
Yeah, so I turned 65 in January. Should I wait to call to enroll until October? No, give us a call right away. Yeah, give us a call right away if you turn 65 in January. Yeah, we want to make sure that we get you set up if we can do it now, and if we end up having to wait until the general enrollment period, then we might have to wait, but we definitely want to see if we can get you, coverage right away.
My next question is Teresa Spencer.
Talking about Medicare and Medicaid, my choice waiver. Oh boy. Okay. So that may be a can of worms that's better to talk about one-on-one. You want to keep him home. So Teresa, can you, let me see if I can send it to you in just the chat. Let me see. I'm gonna get you my telephone number, Teresa, because that's something that we can talk about specifically. Or maybe I can't. Well, whatever. We'll put my telephone number in the chat. Anybody who wants to grab it, grab it. But definitely give us a call, either the 800 number, Teresa, or you can call my direct line, or you can email me directly, because that's my choice waiver is a subset of Medicaid. It is available for those that need to or want to age at home, but it is something that works with Medicare. But the application for the waiver program actually takes place through the area agencies on aging. So I can connect you with that department and make sure that that gets processed. But there might be a few more pieces of info that are going to be specific to you in your situation. Let me see. I don't know if I can type this into the Q&A. Let me see. 248. Oh, whoops.
Yeah, but it's just type in answer.
Okay. So did that go for everybody, or was it just for that one?
It might be for that one. Yeah, it's just for that one person. So maybe it's better to put it in the chat.
Yeah, I did toss it into the chat already. If it's
Okay, so then everyone has it.
Yeah. But I also did type it there too, just in case. But yeah, it should be in the chat too, if you guys hit that chat box.
Okay. I'm not sure, does John R has another question? Let's see. You can unmute yourself. Okay, so maybe not.
And then I do see Helen Seidel.
So if that's all the questions today, we can end our meeting today. This has been recorded, and we will send the slides out to everyone. Always feel free to reach out to David Cook here at Turner. He has a wealth of information and is always eager to help everyone. You will probably talk to me when you sign up and log in to actually, talk with David Cook, and he's available on Tuesdays and Thursdays. So thanks everyone for coming out or signing in.
I know it.
And thank you,
yes,
Melissa, for joining us. We really appreciate you.
Yeah, it's my pleasure. And like I said, I'm, happy to answer any questions too. If you guys need to give me a call, and if you need to or want to meet in person and you want to meet with Dave, he's one of my volunteers in Washtenaw County, and he is phenomenal.
Yes,
he's phenomenal. I can't say enough good things about him. You'll be in good hands if you reach out to him and talk to him too.
All right. Thanks again, everyone.
Thank
Bye.
you. Have a great afternoon, everyone.